Hello everyone. Our case for today is something very important. It's called acute exacerbation of bronchial asthma. So the patient will have difficulty breathing, grasping for breath. So what do? The first thing that you want to do, you want to assess, is there a respiratory failure or there isn't? If there is a respiratory failure, impending respiratory failure, then you do intubation, mechanical ventilation, admit to the ICU. You shouldn't be surprised. Actually, you get cases like this in the exam. Intubation, you have to intubate. Don't be surprised with that. Intubation. And then you administer albuterol, ipratropium, and you administer systemic steroid. Okay? So this is if there's a respiratory failure, when there's the oxygen, the pulse ox is really low, and the PEFR is very low too. Okay, but if there's no suspicion of respiratory failure, then you do so respiratory failure based on the symptoms. There's chest retractions, grasping for breath, like patient is unconscious. Okay, that's respiratory failure. But if the patient doesn't have any of those, he's just having difficulty breathing, then you do the peak expiratory flow rate. You look at the peak expiratory flow rate. If the peak expiratory flow rate less than 40, or if it's more than 40, okay? If it's less than 40, you give oxygen with the goal of pulse ox more than 90, and then you administer albuterol, ipratropium, IV steroid, and reassess peak expiratory flow rate every hour. If it's still low after 4 hours, then you admit. Okay, this is very important. But if the peak expiratory flow more than 40, then you do oxygen till the pulse ox more than 90. You give albuterol by nebulizer. You give oral steroid in this case because it's not that bad. We don't need systemic steroid. You can do systemic too, but oral if there is more than 40. Okay. If the peak expiratory flow rate doesn't improve more than 70 after 4 hours, then you admit. Okay. If it didn't improve within the first 1 hour, you give ipratropium. If it didn't improve after 4 hours, then you give, you admit. So basically it's simple. For both of them, you do oxygen, albuterol, ipratropium, and steroids. So that's simple. Just make it easy for you. I think it should be fine if you do. Because we do that. In real life, that's what we do. It's very simple. Like in the exam, they make it like a little bit complicated. But in real life, that's easy. The decision to admit. What is the decision to admit? Number one is there's the peak expiratory flow rate less than 40% after 4 hours. Okay. Another thing, if the peak expiratory flow rate 40 to 70% at 4 hours, then we consider admission. Okay. If the peak expiratory flow more than 70% at 4 hours, then you just discharge home. Okay. See you in the office. Come back in the office. They will be fine. Okay. Now let's walk you through a case. First, we do in the ER, you do police PS, pulse ox every hour, IV access, head elevation, cardiac monitor. After that, you do focus physical exam. After the focus physical exam, you want to do the ABG peak flow because the oxygen is low. So you do ABG. That's every time you have oxygen is low. Peak flow, EKG, portable chest X-ray, CBC with differentials, BMP. Okay. You do albuterol, prednisone, oral or IV methylprednisone, doesn't matter. And you monitor pulse ox and peak flow. You monitor every hour. That's what you do. You do Q hour. And then you just reevaluate every hour. Just see, check on him. Listen to the lung. Just interval history. And then if it didn't improve, you can add ipratropium nebulizer and reevaluate every hour till 3 hours. 3 hours, same thing. You look at the peak expiratory flow rate. Above 70, discharge home. Less than 70, admit. Let's suppose it's less than 70 after focus exam and everything. You admit. You do V-panic and peak flow every 2 hours. NPO, IV access, normal saline. And then reevaluate every 2 to 4 hours. Once the patient improves, just cancel him and you do null per mouth. You cancel the NPO once he gets better. Cancel bed rest, cardiac monitor, and order normal diet and ambulate out. So basically, it's very simple. Just don't complicate yourself. Forget all of these. Just remember, initially you do the police BS, After that, you do the EBG and you give him albuterol ipratropium steroid, and you do pulse ox and peak flow every 2 hours. The patient usually gets better within 4 hours. Send him home, follow up in 2 weeks. If it didn't get better, admit. Make sure that you have the V-panic running already, and you just follow up at this moment. So this is with the CCS case. It's very interesting. Like for each case, there is a treatment, specific treatment. You do that, and then you just follow up. That's it. Very simple. Okay. Thank you so much for listening, and we'll see you on the next one.